last time we had a press conference, it was a critical situation. We were at the beginning of the fifth wave. Today, I think it is with a more positive message that I want to do this press conference, because we have seen in the last 5 weeks that all our indicators are decreasing. So we're positive with the withdrawal of some progressive withdrawal of some populational measures, and of course we want to make sure that we still stay vigilant, because we know that, of course, we can see other variants coming in, and the virus is still circulating at a high level in Montreal. So we're those reopening or those reduction in the populational measure, we're comfortable with it, because of course we're at the peak of the Omicron peak is behind us. It has infected a lot of a great percentage of the population. We estimate around 30%, but it is possibly more than 30%. And of course, we wanted to give the third dose to a majority of the vulnerable population at the time we're speaking. For the 70 years old and older, we have more than 85% of this group that has had its booster dose. As I was saying, all our indicators are decreasing. At the current time, we have 500 people hospitalized with COVID-19, 43 in intensive care unit. In the last week, we had 9 deaths associated with COVID. It is quite a big reduction that we're seeing each week. And our incidence rate, even though they're not perfect because we do not screen the same way as we used to, our incidence rate and positivity rate are decreasing week after week. This has an incidence also in outbreaks that we have to manage. We have 50 outbreaks currently in elder residency and 10 in shelters, homeless shelters. And when we look at school daycare centers, we see a reduction in the rate of people that are not in school because of they are ill by COVID-19. So it is, all indicators are going in the right direction. So we're talking about living with the virus. It doesn't mean that there is no risk. We're in an endemic phase at the time we're speaking. We still have the possibility to see different variants, and we're seeing it in other jurisdictions that are coming in. But at the same time, we are more pausing ourselves as in a transition phase. And in this transition phase, there are some habits or things that we still have to do that will protect ourselves, but also that will help us to pass the next couple of months ahead of us. What we're asking the population, of course, if you have symptoms, we ask people to test themselves. Rapid tests are accessible in pharmacy. Right now, the screening centers are open for people age over 70 years old or with immunocompromised syndromes, because they can access antiviraux, donc medication that can reduce the risk to be hospitalized. So it is important to get tested, stay at home. The isolation that we're asking is of 5 days at home. Afterwards, we ask people to do a second test to see if it's negative, so they can reintroduce their activities. Of course, between the 6th and 10th day, we're asking people to wear masks and do not visit people that are vulnerable to the virus. Masks are still measures that is effective to reduce transmission. So when we're talking about being indoors, in crowded spaces, and with close contacts, we still think that it is an appropriate measure to maintain at the time we're speaking. And of course, we ask people to get their third shot if they haven't gotten yet. If you add the Omicron virus, because we know there's a great proportion of our population that add it, please wait 8 weeks before having your booster. And right now we had a recommendation last week for the group age 12 to 17 years old. It is recommended if you have a chronic disease or if you are immunosuppressed, and it is offered if you want it, but we're not going to go in school necessarily to offer this booster dose. I want to take this moment also because it has been 2 years that we've been working on this pandemic, and I think we wouldn't have been able to to have those success without our partners. So I want to say thank you to Montrealers that have been with us during those 2 years. I want to thank especially all healthcare workers, our partners, schools, daycares, workplaces, and I want a special thanks to community organizations that have delivered services to the most vulnerable population during this pandemic, and that have helped us be able to go and to reach those population. I don't think we would have had the same success with our vaccination rates if we hadn't worked in Montreal with community organizations. So thank you. And I want to say thanks to all the people that have joined the force, the public health force, during those 2 years. It's more than 1,000 people that have joined our teams to make sure that we were able to investigate and manage those outbreaks. So thank you. I think we wouldn't have been able to do so without this force. To conclude, I just want to say I think this reopening and reduction in the populational measures is welcome. I think we still have to be prudent, and I told a little bit what we are asking the population to continue as habits to reduce transmission. And the last message I want to say is, not everyone is comfortable at the same pace in front of this reduction in measures. So I think we have to respect the rhythm and how people are facing this transition phase, and we have to respect and support those persons. So thank you very much, everyone. I think. I hope it's our last press conference on COVID-19.